Madame la Ministre, bonjour. Merci de nous accueillir.
Good afternoon, Mrs. Minister. Thank you for hosting us. There's been a law in 2005 for disabled people. All disabled people are entitled to protection from the community to guarantee their rights. There was a very strong definition of national solidarity. Where do we stand? 15 years later, there are two strong words: national solidarity, to be a full-fledged citizen. And it is after 15 years, when we had the National Conference on Disability in 2020, where do we stand 15 years down the line? And there is national solidarity. But there are no responsibility, and the disabled people have to be subjects of law and not only citizens. So we want that law to be proactive, to be actual. We want actual solidarity, and that's why when we think that we should all be involved and mobilized, we are all far from being there. So we haven't achieved national and collective solidarity yet. So meaning that we might still be assisting. It seems that we've had the solidarity that was not the one that we expected. Shouldn't we challenge this? In fact, we've been quite protective for the past 15 years. You know, protection of people has been the key word. And now we're looking at their emancipation. So we want to give the possibility to people to react and not to be protective anymore. And it's been the beginning of a society which is looking at people for their ability to choose to free themselves. So there's been a UN report, and after the Second World War, we have decided to leave it to the associations, parents' associations, and disabled people to be the players of that construction. And they've done a very good job. But now these people, they're asking us, give us the power to take actions. We do have great professionals in our country, and COVID was a very good experience about that. Now, before we talk about COVID, when you go on the field, it seems that things are moving. Yeah, things are moving a lot in all areas, in schools, inclusive schools, medical, social, are seen as partners within schools. It changes in the way adults are being taken care of with different housing. That inclusive society is on the way. And inclusive housing, you know, for example, I want to develop it. But we want to be able to live in all those mixed generations, to assist people as much as possible. We need to demonstrate that we can assist them, we can help them in making choices for schools, for their jobs, for their daily lives, and for housing. I think that's essential for changing the way we live together. So this notion of solidarity and inclusive society, do you have the feeling that that opening has made it possible for people who didn't have that relation with disabled people to look at it in a different way? We're talking about a collective solidarity. It is a collective and a citizen solidarity, but also the fact that we take different people into account. We look at people differently. Last week, we went to open the first school for disabled children, And I've heard 8-year-olds telling me, well, where were they? Because we had never seen them before. So in fact, the point is to welcome somebody who's completely different, but we're going to work on that generational change. But I want this to go much faster. That responsible, that constructive reception, the fact that, people can grow together and give them some room. Do you have the feeling that COVID has been a second wind? COVID has been incredible because people, children, adults, going back home, because schools have closed. And so adults have been working from their homes. And so professional people have told me that they had discovered people's expertise, and there were a different way of working together. And people in the field have learned how to know each other better because, for example, some people have worked together in a much better way, and I want to capitalize on this to remove obstacles. There are quick reforms that we want to do too. We have created 360-degree communities. What do you mean by 360-degree communities? Everybody is sitting around the same table. So we have a central pole and everybody is around the same table. And we derive medical social expertise, the mayor, the municipality, the businessman, the leisure center. So we've changed our way of living together during the COVID. Do you have the feeling that it has changed the health area and the medical social area, and to rethink the problem of disabled people? Has it been a way to change things because we are lagging behind? We are really lagging behind. We've seen that with treatments to disabled people showing serious respiratory risks. In fact, we've helped caregivers to come and explain, or to let people come and explain in the emergency room. How do you connect all players? But here I'd like to address all professionals. In their initial training, assisting disabled people is not developed at all. We need to connect all people, community, medicine, hospitalization at home. There's a lack of cooperation between players, and disabled people are people before all, and there's a lot of work to do, and we're going to move forward because we've seen that we could do it. You're talking about prevention, but there's a major challenge in prevention, and in that prevention, we want to help people to get to grips with their life and to start loving their body. And this is paving the way for other areas of activities, like sports activities, all those new areas. It is indispensable. In the different facilities now, they do have professionals from the sports area, from culture. So it has to go in both directions. We have significant technical sets. So let's have citizens benefiting of them. And we want to help them to think that there are things that are possible. To build my body is very important. Gynecologic prevention for women is very important. Some women turn 50 without having seen a gynecologist. So sometimes it has helped them to have a love life, for example. So to live like anybody else in your body, your sexual life, your relationships. You said that it was necessary for facilities to open the doors. So you think about that new form of solidarity. It could be a platform, but it's a revolution to open the doors of the facilities. But we've done it already, and it is being done more and more, notably thanks to the lockdown in many territories, but there's a great inequality. So I am the minister of disabled people wherever they are. So the expertise for hospitals, for a medical, social institute, we need to connect experts. You know, it's everybody has an expertise, and that's what national solidarity is about. So we need to offer journey to people. And with the person. The person as being a citizen. And some people are saying, but this is not possible, you know, when you are a severe autist. Well, there are communication means, you know, because this is the Stone Age, and there are big challenges ahead of us. We need to give meaning to that policy. We need to give meaning to that inclusive society. It means that we have to live with the others, not like them, but with them, and we need to be able to make it. Do you have the feeling that we are ahead of time when you look at what is happening elsewhere, like in Europe? CHAM is always looking at the European dimension. Don't you think there are examples that we could derive from other countries? When I came in 2017, I went around Europe to see how the inclusive society was being broken down. But we're lagging behind in France, because many countries have done that revolution 30, 40 years ago by sending disabled children to normal schools. Now, we're doing it in France now, but we've lost one generation for accepting difference. 46 billion are allocated to disability, and that's a lot. But people don't feel it because we have funded walls instead of funded staff and people. And that's a big revolution. So we are getting there. There's a big reform to talk about services to the people. The revolution is underway. It's a complicated one. The medical social world is diffused. There are many associations, but there's a real need. And we're not going to go all the way to the Nordic countries where facilities are closed, because it's not our culture, and we do have differentiated territories. But I'm wondering how we can assist professionals. How do I secure professionals to help people to find a job, to help them in their daily life? That's what the challenge is, to help our professionals, because we have a very nice fabric of medical social professionals to help to assist people, to remove the self-censorship that we have when we feel that we are not going to be able to do it. I used to work with Muriel Pénicaud, and the motto was, nobody, everybody can find a job. And so we're changing things. We need to speed up. We need to secure those journeys. We need to show people that it is possible, that it should be a long-lasting assistance, a quality one, and we should take on board the ecosystem of one territory to mobilize everybody. It's a very strong message that you are conveying to the people who are listening to us. In fact, each of us, we should be able to make it. It's an ambition which is shared by many people. So we should be able to make it. We need to understand where the challenges are, and this government should be on the side of associations, players, the different government services on the territories. It's a different working method. We need to capitalize on the lessons learned from the lockdown. We're going to have to live with this health crisis for a long time. So it's the right time to show that that solidarity is possible. We just need to make it a reality. Thank you very much. Thank you. Thank you, Philippe de Normandie.